Hi guys, this is Dr. Rajaratna Thangavel. I will be discussing embryology of eye in this video, okay. So what you should know, one thing is, except for endoderm, everything else participates in eye development. So that means we have neuroectoderm, surface ectoderm, we have neural crest cells, we have mesoderm, all participating in eye development. So basically how does this eye development start? Most important is this neuroectoderm. So you have the forebrain, and at the junction of the forebrain and the midbrain you have a outpouching, okay. So this outpouching is what we call as the optic bud, okay. So we have optic bud on either side. So this is the forebrain, right. So basically this is neuroectoderm, okay. Now this optic bud, as it grows, it develops a stalk and becomes an optic vesicle, a fluid filled vesicle, okay. So now this is an optic vesicle. So like this on either side it will go, the other side I am not drawing. So this is the optic stalk and we have the optic vesicle, and this neuroectoderm is going to grow towards the surface ectoderm, okay. So we have got surface ectoderm here, right. So this is like a story. Now week 3, what happens? By the time it's week 3, this optic vesicle approaches the, almost is close to the surface ectoderm. So there is an induction that goes on, okay. So this neuroectoderm coaxes the cell of the surface ectoderm to multiply, okay, to multiply and differentiate. So by week 3 we have surface ectoderm destined to become lens cells, okay, to become the lens, to form the lens, right. So you have optic vesicle, this is the optic vesicle, and this is the surface ectoderm. So the development of the lens starts by around day 22, okay. So week 3 it starts, okay. By day 22 the lens development from the surface ectoderm kind of starts. So what happens in week 3, okay. So week 3 there is a dense collection of cells, lot of cells have multiplied in this area, okay. So it's like a disc, it's like a disc. What do you call this area now? This is called as a lens placode, okay. I'm sorry, week 4, right. So this is week 4. So week 4 you have formation of, I am talking about gestational age, okay. Week 4 there is formation of lens placode and our optic vesicle is here. Now what happens in week 5? There is so much of multiplication and it develops a pit, this area develops a pit, okay. There is a depression, what is called as lens pit, okay. This is the lens pit in week 5, right. So now what happens? This lens pit is going to sink in. So the cells that have divided and accumulated there, they are going to separate themselves from the surface ectoderm. So that happens in week 5. So week 6. So week 6 what happens? So this is your surface ectoderm. Now too much autonomy, you know, there are so many cells there. So it thinks like, you know, I can separate myself from the surface. So now I have a fluid filled lens vesicle, okay. So it has separated from, okay. So week 6 it has separated from the surface ectoderm. Do you understand? Now by that time it will cause some change in the optic vesicle. So the optic vesicle becomes like a optic cup, okay. It becomes like a cup. Do you understand? So it's like a story, you know. So week 3 the cells that are destined to become lens on the surface ectoderm, that because those genes start expressing themselves in the epigenetics. Week 4 lot of multiplication and the thickening of the surface ectoderm happens. Okay, so that's called lens placode, which happens week 4. Now week 5 there is a pit. So it's having like second thoughts. Okay, should I stay here or should I move away? So the thought is happening at week 5. Now week 6 it elopes. Okay, it elopes and then that means it separates from the surface ectoderm. Now when it has eloped, it will expect something to happen at the optic vesicle level, no. So it is said, so my lens vesicle is saying, hey optic vesicle, I have eloped from my house for your sake, so I want you to change. So now the vesicle, which was like a ball, it develops a, it becomes like a cup. Do you understand? It becomes like a cup, right? So this happens at week 6. Now what happens in week 7? So week 7, the lens epithelial cells, okay, in the lens vesicle, they enlarge to form the primary lens fibers. Okay, so whatever cells you saw here, the previous week 6, right, those enlarge to form the primary lens fibers. Okay, so the primary lens fibers, as you see, will be nucleated like this. So now there is no more cavity in the lens. So these are the primary lens fibers. So these epithelial cells from the previous stage, they elongate to fill the entire cavity. Okay, so this is how the lens is fully formed by week 7. So these primary lens fibers, what do they form? They form the embryonic nucleus, the first formed nucleus, right. So starting from this stage to 3rd month, okay, to the 3rd month of gestation, whatever is formed, that is embryonic nucleus. So from week 7 to 3rd month of gestation, whatever fibers are formed, that will be embryonic nucleus. Is that clear? So you know for sure that the surface ectoderm gives rise to the lens. So now let us see what are the other structures that arise from the surface ectoderm. Okay. Now surface ectoderm, it's very easy to remember. I will tell you surface ectoderm S. So S5. So 5 structures arise from the S. So what is the 5 structures? 3 plus 2. 3 plus 2 is 5. So there are 3 L structures starting with the alphabet L and 2 EC structures. Okay, and it's 2 EC. Literally what I am saying is it's EC. Now what is this EC thing? So we have 3 L's, okay, which is already you know lens. Then we have the lacrimal apparatus, that means the gland, the excretory system, the drainage system, everything, okay, and the lids. In the lid, the skin and the glands associated with the eyelids, right. Now what is this EC? Epithelium of a structure which is on the surface ectoderm giving rise to a epithelium of something on the surface. Similarly, the second EC is also epithelium of another C wala structure. What are the 2 C structures, surface C structures? One is conjunctiva and the other is cornea. Okay. So these are the only 5 structures in the eye that arise from the surface ectoderm. Okay. So that's why I told you 5 structures, which is 3 L's plus 2 EC. Okay. So EC is this and 3 L's. Simple. Surface ectoderm is the simplest of all. Alright. So now we will go to neuroectoderm. So neuroectoderm we will draw from something that we know. Now what do you know? We know that from the forebrain we had this optic stalk which had the optic vesicle, and you remember optic vesicle became an optic cup, right. So common sense tells me that this neuroectoderm from the brain, right. So this stalk, what is this? This optic stalk. So optic stalk is going to become my future optic nerve. So, from neuroectoderm comes my optic nerve. Yes, so we are talking about neuroectodermal derivatives. Okay, neuroectodermal derivatives in the eye. Right. Now, this optic cup, this is the optic cup, right. So, optic cup gives rise to the retina. Okay, it gives, because you know the nervous layer of the eyeball is the retina. So, this gives rise to the retina. Okay. Now, in retina we have 10 layers, you already know that. We have the outer RPE and the inner neurosensory retina separated by the subretinal space. So, this original cavity of the optic vesicle becomes the subretinal space. Okay. So, what forms your subretinal space? This optic cup. So, you remember that initially the optic vesicle was there, which became the optic cup. So, the original cavity of the optic vesicle becomes the subretinal space. So, that means this outer wall, or what we call outer lip of the optic cup, gives rise to the RPE, and the inner lip of optic cup gives rise to the neurosensory retina. Okay, it gives rise to the neurosensory retina. Is that clear? Okay. Now, this outer lip continues to grow to form the ciliary epithelium, and okay, the ciliary epithelium. So, you have the pars plana and the pars plicatum, and the iris epithelium, because now the surface corneal and, epithelium and conjunctival epithelium has come from the surface ectoderm. Okay. And the muscles of the iris, okay, the muscles of the iris also come from the neuroectoderm. So, that means the dilator pupillae and the sphincter pupillae, they also come from the neuroectoderm. Now, what else comes from the neuroectoderm? See, I already know that there is a lens which has come from surface ectoderm. Now, but poor thing, it is not connected. So, let us connect it. Okay, it is easier to remember. So, now the zonules come from neuroectoderm. Okay, let us put the same color for this also. So, we know what all come from neuroectoderm. So, the iris with its muscles, and now there is a big space between the retina and the lens, the vitreous, that also is coming from the neuroectoderm. Okay, so this is like a story. So, you have the optic nerve, the retina, right? Then you have the ciliary epithelium. See, ecto is going to give rise to the epi always. So, surface epithelium comes from surface ectoderm. All these inner structures epithelium come from neuroectoderm. So, you have ciliary epithelium, iris epithelium, the muscles of the iris. Then what is left? The lens is like one orphan standing there. So, connect it. You have the zonules. Then you have this big space between the retina and the lens, vitreous, connected. So, now let us list it out. So, number 1, optic nerve. Number 2, retina. Number 3, ciliary epithelium. Number 4, iris epithelium. Number 5, iris muscles. What are the iris muscles? Both dilator pupillae and sphincter muscle. Then the zonules and the vitreous. Okay. So, these are the structures that arise from neuroectoderm. Okay. Okay, these are the structures that arise from neuroectoderm: optic nerve, retina, ciliary epithelium, iris muscles, the zonules and the vitreous. Okay. Now, the vitreous gel, is that clear? So, this is about the neuroectodermal derivatives. Now, what we have? We learn mesoderm. Mesoderm is very, very simple. Okay, mesoderm hyaloid artery. Okay, you know all vessels come from mesoderm. So, hyaloid artery. What is this hyaloid artery? See, you have the optic nerve, right? You have the optic nerve and the lens. In the fetus, the lens has a vascular supply. So, this vascular supply extends between the optic disc and the posterior pole of the lens. This is called as hyaloid artery, also known as primary vitreous. Okay, also known as primary vitreous. Is that clear? Then the choroidal vessels. Okay, the choroidal vessels. Then the belly, the fleshy portion of the extraocular muscles, and a small portion of the sclera, small temporal portion of sclera. Okay, small temporal portion of sclera. So, these are the only 4 things that arise from the mesoderm. Yes, these are the only 4 things that arise from the mesoderm. Now, what happens to this hyaloid artery? The hyaloid artery regresses at birth. So, just let us learn a little bit about this hyaloid artery. So, this hyaloid artery regresses at birth, leaving behind an empty canal, empty space called as Clockett's canal, okay, called as Clockett's canal, right. So, now we need to know what are the remnants of the primary vitreous, because what is the other name for hyaloid artery? Primary vitreous. So, what are the remnants of primary vitreous? So, usually it is that Clockett's canal, okay. So, if you see in the center of the vitreous, there will be a empty space, okay. So, that is the lens, this is the retina with the optic nerve. So, in between you have this vitreous, right. So, if you see in the cadaver, not in a normal patient, okay, in a cadaver if you see, you will see an empty space in this region which represents the Clockett's canal. You see that? So, this is Clockett's canal, which is an empty space. Now, sometimes what happens is the attachment on either the lens side or the optic disc side can persist, okay. So, if there is a persistent attachment at the optic disc end, what is it called? Okay, at the optic disc end. So, that means you are going to see some attachment here. So, this is called as Bergmeister's papilla. Okay, this is called as Bergmeister's papilla. Now, suppose there is persistence of attachment at the lens end, that means at the posterior pole of the lens. Okay, everything else has disappeared, but this end there is a persistence of attachment. So, this is called as Mittendorf's dot. Okay, this is called as Mittendorf's dot, and Mittendorf's dot is associated with a posterior polar cataract. Okay, it is associated with a posterior polar cataract. So, normally there is an empty space Clockett's canal. If there is persistence at the optic disc end, Bergmeister's papilla, easy to remember. What is the other name for optic disc? Papilla. So, Bergmeister's papilla. If it is persistent at the lenticular end, it is called Mittendorf's dot and it is associated with the posterior polar cataract. Now, sometimes where, see, all these are visually insignificant. Now, the one that I am going to talk about, that is, sometimes this primary vitreous, the hyaloid artery proliferates. Okay, it not only persists but also proliferates. So, it is a combination of vascular and fibrous tissue, what we call as PHPV, that is persistent hyperplastic primary vitreous. Okay, persistent hyperplastic primary vitreous, which is now known as PFV, that is persistent fetal vasculature. Okay, persistent fetal vasculature. Is this clear? Okay. So, these are all the normal remnants and the abnormal remnants of the primary vitreous or the hyaloid artery. So, about this PHPV, I will talk about it in vitreous. Okay. So, this is about mesoderm. Now, whatever is left goes under neural crest cell. Okay. Whatever we have not talked about. So, we know surface ectoderm 5, neuroectoderm 7 structures and 4 structures for your mesoderm. Anything that is left behind will go for neural crest cells, NCC. Now, in NCC, I want you to remember a few structures offhand. So, even in your sleep, you should be able to say what are those. One is ciliary muscle. Okay, so ciliary muscle arises from neural crest cell. The orbital bones, okay, the orbital bones, the sclera, okay, most of the sclera comes from neural crest cell, only a small portion comes from mesoderm. Then tendon of extraocular muscles. Okay, tendon of extraocular muscles. The belly of extraocular muscle comes from mesoderm. Yes, the S is stroma of all eye structures. Okay, of all the structures. That means iris stroma, ciliary body stroma, choroidal stroma, corneal stroma, everything comes from neural crest cell. Is that clear? So, I want you to remember these things offhand. Now, if I ask you Descemet's membrane, neural crest cell. If I am asking you Bowman's layer, neural crest cell, endothelium of cornea, neural crest cell, Tenon's capsule, I mean you name it, whatever has not been covered in the ones that we have done so far, all of them will go under neural crest cell, but I do not want you to think and come up with it. So, that is why I have told you these structures which you have to remember. So, the moment I say orbital bones, you will not check, okay, is it in surface ectoderm, is it in neuroectoderm? No. You immediately have to say that it is a neural crest cell. Okay. So, ciliary muscle, orbital bones, sclera, tendon of extraocular muscles and stroma. So, now the question is, if they are simply going to ask sclera, where is it derived from? Sclera mainly NCC. Okay, NCC is a better answer compared to mesoderm. But if they are going to give you A and B, then you go for A and B. Now, similarly, extraocular muscles. Extraocular muscle will be the ulta. Mesoderm more than NCC. Why? Because belly is the biggest part. No, the bulkiest part of the muscle is the belly. So, belly comes from mesoderm. So, extraocular muscles, mesoderm is a better answer compared to neural crest cells. Okay. Now, this is about the various layers from which the ocular structures are derived from. Now, there is something called as embryonic fissure. Okay. There is a structure called as embryonic fissure, or what we call as choroidal fissure. Now, what is this embryonic or choroidal fissure? So, what is this embryonic fissure or choroidal fissure? So, if you see this optic stalk, okay, this optic stalk will develop a fissure like this on its inferonasal side. Do you see that? So, the optic stalk is going to develop a groove, okay, it is a groove, so that the central retinal artery eventually gets inside. You know, no, the central retinal artery gets inside. So, this is a groove, okay. So, that is what is the embryonic fissure or choroidal fissure, which develops at day 22, okay, develops at day 22 and it closes. So, this vessel goes inside and eventually it closes, it fuses. So, this fusion occurs at day 35, or what we say at the end of week 5, okay, end of week 5 it closes. So, what is the location of this embryonic fissure? It is inferonasal in location. Okay, it is infranasal in location. Now, supposing there is a failure of closure of this embryonic fissure, what will happen? All the structures that are derived from this neuroectoderm, yes, will lack tissue corresponding to this infranasal area. So, any congenital defect or deficiency of tissue is called as coloboma. Okay, it will result in a coloboma. Okay. So, failure of closure of embryonic fissure at day 35 will result in a coloboma. Coloboma of what all structures? Chorioretinal coloboma. See, retina is a neuroectodermal structure. Now, choroid develops almost along with the retina, right? So, the influence of retinal development will always be there on the choroid. So, you will have a chorioretinal coloboma. Then, you can have a iris coloboma, because you know the iris epithelium and the iris muscles develop from the neuroectoderm. Now, in the lens, okay, you will get a coloboma. Now, that's because of zonular deficiency in that area. It's not because of the lens itself, right? Because you know the lens is a surface ectodermal structure, right? See, normally the lens is like this, circular when you see it from front, with the zonules attached all around, correct? Now, if I don't have zonules in the infranasal region, so if this is my right lens in the infranasal region, so that means this area I don't have zonules. See, zonules literally stretch the lens, so that stretch is missing. So, what happens to the lens? The lens develops a wedge shaped defect. So, this is why this is called a lens coloboma, but actually it is because of the missing zonules. Yes. So, failure of closure of embryonic fissure can result in coloboma in these structures. What all structures? Chorioretinal coloboma and iris coloboma typically, and also in lens, okay, because of the zonular absence. So, let us see how iris coloboma looks like. Okay. So, this is how an iris coloboma looks like. See, the right eye, you can see it is like a pear shaped pupil. Why pear or tear shaped pupil? Because in this area the iris is missing. Why? You remember I told you infranasally the choroidal fissure or the embryonic fissure is there. If that is not closing, definitely you will have coloboma. And what is the location of this coloboma? Again, infranasal. So, a typical, whenever we say a typical coloboma will always be infranasal in location. And what is the reason for this iris coloboma? Again, failure of closure of that embryonic fissure. So, what is the shape of the pupil? We describe it as tear shaped or pear shaped pupil, okay, tear or pear shaped pupil. So, this is the right eye. So, this is the infranasal, okay, this is infranasal, and for the left eye the nose is here, no. So, infranasal. So, can you see the coloboma here? So, this is iris coloboma, alright. So, this is a picture showing you chorioretinal coloboma, okay. Now, how am I saying it's chorioretinal coloboma? See, this is the optic disc. So, I can see the optic disc here, okay. So, that is the optic disc, and this huge white area is an area where the retina neither has a retina developed nor the choroid has developed. So, this is an area of chorioretinal coloboma. So, what is the underlying cause again? Failure of fusion of the embryonic fissure. So, this is an important IBQ, okay, image based question that you need to know, right? Yes, okay. The problem with the chorioretinal coloboma is the retina is very thin around it. The normal retina, which is just here, will be very thin, and there is a chance of rhegmatogenous retinal detachment developing there, and retinal holes or tears developing there, okay. So, that is the problem with chorioretinal coloboma. Now, this is a picture showing you lens coloboma. So, you can see the dilated pupillary margin, and you can see that little indentation in the lens equator. So, this is the lens equator, and you can see the fine zonular attachment here. I do not see much of zonules. So, this is a case of lens coloboma, indirectly developing in a case of, okay, lens coloboma, indirectly developing due to the absent zonules in the inferonasal quadrant. Okay. So, you see a wedge shaped defect in the lens. Is that clear? So, this is about embryology of eye, and I think it is very simple. Embryology of the eye is very simple. All that you have to know is surface ectoderm, then neuroectoderm like a story, it is like a love story, and then you remember mesoderm 4 structures. Anything that is not fitting into this is going to be into neural crest cells, alright. Endoderm does not play a role in eye formation. Is that clear? So, that is all about embryology, guys.